Thanks for tuning in to Planetterrian Daily, episode 56 for May 6, 2026. Let's see what the latest research is telling us. A single 25 milligram dose of psilocybin produced measurable brain structural changes in healthy adults that persisted for at least 1 month. A crossover study of 28 healthy volunteers with no prior psychedelic experience showed this outcome clearly. The 25 milligram dose created detectable shifts in brain structure at the 1 month mark, according to imaging results. The 1 milligram control dose produced no comparable structural changes. These findings identify a concrete window for studying how brief pharmacological interventions can influence adult neural architecture. The changes appeared without any previous psychedelic exposure in the participants. Psilocybin produced clear structural shifts visible on imaging 1 month later, distinct from the minimal effects of the lower dose. This opens a window into how brief interventions might influence neural connectivity in adults with possible relevance for mood and cognitive disorders. Larger trials will still be needed to connect these structural observations to functional or clinical outcomes. Most people assume the brain's basic wiring is finished by early adulthood and changes little afterward. In reality, the adult brain retains substantial capacity to alter its physical structure in response to experience or compounds. Right now, as you read this, synaptic connections throughout your cortex are being strengthened or pruned based on what you pay attention to and what you encounter. A recent study captured one striking example with a single 25 milligram dose of psilocybin producing measurable shifts in brain architecture still detectable 4 weeks later. That duration of 4 weeks of visible change after one exposure illustrates how quickly and durably the adult brain can reorganize. Everyday choices such as learning new skills or managing stress continue to reshape neural tissue well into later life. Future therapies may deliberately harness this ongoing plasticity rather than assuming it has ended. While targeted compounds can drive measurable brain changes, a long-established behavior offers even broader effects on disease risk. New evidence synthesis positions regular physical activity as one of the most effective tools for lowering risk across multiple disease categories. The review underscores that exercise works through overlapping physiological pathways rather than any single mechanism. This multi-pathway action helps explain the wide range of benefits observed across cardiovascular, metabolic, and neurological health. Regular movement influences inflammation, insulin sensitivity, and vascular function simultaneously. The synthesis draws together data showing consistent risk reduction even with moderate activity levels. These results strengthen recommendations for physical activity as a foundational prevention strategy. On a different note, population-level prevention also depends on accurate expectations for screening tools such as colonoscopy. 13-year follow-up data show that colonoscopy delivers measurable but smaller reductions in colorectal cancer incidence and mortality than earlier models predicted. The narrower benefits help refine realistic targets for what population screening programs can achieve. Earlier projections may have overstated the population-wide impact based on shorter-term observations. These longer-term results allow planners to adjust resource allocation and communication around screening. Colonoscopy remains a valuable tool, yet its expected yield needs calibration against these findings. Shifting focus now to advances in biotechnology, where precision at the molecular level is improving. Researchers can now reliably construct and insert very large DNA segments, including complete metabolic pathways and extra chromosomes, into yeast and bacteria. This capability allows redesign of microbes to produce complex medicines and industrial chemicals more efficiently. The assembled DNA segments function as ready-made factories within the host organisms. Such advances reduce the time and cost associated with developing new production strains. The technology supports both pharmaceutical manufacturing and sustainable chemical synthesis. Precision at the molecular level also matters for understanding and addressing widespread nutritional deficiencies. An analysis spanning 1990 to 2021 quantifies iron deficiency anemia burdens among women of childbearing age across regions and nations. The detailed geographic patterns supply public health planners with clearer targets for intervention. Certain regions show persistently higher rates that correlate with dietary and environmental factors. Mapping these burdens over 3 decades reveals both progress in some areas and ongoing challenges in others. The data enable more precise allocation of supplements, education, and fortification programs. Such geographic insights support tailored strategies that address local needs effectively. Geographic patterns of disease pair naturally with efforts to find parasite-specific drug-hard targets. Researchers used PEG 400 to expose a binding pocket on the paschalpane 2 enzyme that exists only in Plasmodium parasites. The discovery provides a route to compounds that disable the parasite while sparing the human version of the enzyme. This parasite-only feature minimizes the risk of off-target effects in human cells. Structural studies like this accelerate the search for selective inhibitors with improved safety profiles. The approach could lead to new classes of antimalarial agents that exploit unique parasite biology. Selective targeting is also being tested in condensed treatment schedules for certain cancers. A United Kingdom trial found that patients with a specific colorectal cancer subtype who received 9 weeks of pembrolizumab before surgery remained cancer-free nearly 3 years later. The short preoperative immunotherapy course showed durable responses in this selected group. These outcomes suggest a condensed regimen may reduce the need for prolonged post-operative chemotherapy. Patients could experience fewer long-term side effects while maintaining cancer control. The results point to opportunities for personalizing treatment duration based on tumor characteristics. Less invasive approaches are also advancing in the operating room itself. Johnson & Johnson's Ottava soft tissue surgical robot met its primary safety and performance endpoints in an initial study of gastric bypass procedures. The data mark an early step toward wider use in minimally invasive abdominal surgery. The system demonstrated reliable performance across the tested cases. Robotic assistance may expand access to precise techniques with reduced recovery times for patients. Ongoing refinements could integrate this platform into additional surgical specialties. These incremental advances across brain biology, prevention, and precision tools illustrate steady progress in understanding and supporting human health. Keep an eye on larger trials that will connect these brain structural observations from psilocybin to specific functional and clinical outcomes. That's Planetterrian Daily for today. If you enjoyed this, a rating or review on Apple Podcasts or Spotify really helps new listeners find the show. I'm Patrick in Vancouver. Thanks for listening, and I'll see you tomorrow. This podcast is curated by Patrick, but generated using AI voice synthesis of my voice. The primary reason to do this is I unfortunately don't have the time to be consistent with generating all the content and wanted to focus on creating consistent and regular episodes for all the themes that I enjoy, and I hope others do as well.